Good morning.
Good morning. Well, we might as well get started right on the 9 o'clock hour. This is Healthy Mothers, Healthy Babies speaking. I'm the director here, and we have Deb and Sarah with us. And thanks for all hopping on our amazing design team. So I just really want to say hello and pass it to Sarah and Deb for the meeting. So thanks for joining us. And we hope that this is a good platform for you guys to do this work on.
Oh, we should probably shut our I'm just gonna wait literally like 30 seconds because there's several dings. So. All right. So you guys all got our agenda in advance. It's possible we won't take 2 hours, so that would be fine with us as well if we can get through this, but we wanted to make sure we had enough time. So just a quick reminder, like starting with an overview of, I gotta figure out how to share my screen real quick, of the timeline and sort of the purpose of our, of this meeting and this grant. We thought we'd just quickly go through that with us again. We had our initial kickoff meeting in February. You guys see my grant timeline slide out there? Yes. Perfect. Thank you. Okay. There you go. Okay. Good morning to those of you joining us. You're not late. We're just getting started. Thanks for joining us. We're just on our first agenda item. Intros, I don't know. Hopefully we can see. We have about 12 people on here now. Can they see each other? Can you guys, I know some of you are phone numbers. If you are a phone number and you want to track of who is on the call, but I don't know that that's really.
If you want to, in the chat section, you can just like chat your name to everybody and then we can see who's on the call. That would probably be easier than unmuting.
All right. So just a reminder, today we're going to go through the timeline. We're going to talk about our role as the design team. We're going to go through how we're going to make decisions, because obviously we have some decisions to make. Then we're going to go through a review of the criteria. Hey, someone out there isn't on mute, so if you can find a way to mute yourself, maybe we can mute you.
I think it might be mine, but
I'm getting a little feedback from someone.
I don't know how to. I'm trying to figure out how to do the.
Now we know who's not muted.
We can hear you. We can you mute other people?
I'll play with that.
Oops,
Like how to call in.
Maybe my slide there.
I know.
Can you hear okay if I do that?
All right. Okay. So if you can figure out how to mute, you should have a little mute button right next to your screen, your face, in the bottom, like left-hand corner of that little screen. Then you can light up yourself and hit mute. And we'll try to mute people too. Okay. So we met in February for our kickoff meeting. We have our virtual meeting right now of this design team, but we're going to meet as a full group again. And it said late spring, but at this point we're looking at June, and then we'll have another in-person meeting. In September, we had talked to our early coalitions, or our local early childhood coalitions, and they had said August is a bad month, everyone's vacationing, we agree. And then we'll have our final meeting at the end of this year. And so at our first meeting, we had reviewed and asked people to submit criteria that we should evaluate data for consideration as a shared measure. So today we're going to review that. We're also going to review the preliminary shared measures that people have given us through the SurveyMonkey and through other ways that people have communicated with us, and we've kept a list as this project has unfolded. And And then we have a little bit of, so just a reminder that the purpose of this design team right now is we're meeting to prepare for the June meeting of everyone, which will be a presentation of potential shared measures to this large stakeholder group for this grant, with the goal of all of you and then all of those other stakeholders taking that list of proposed shared measures out and about and getting feedback and giving it back to us before our in-person meeting in September, so that when we get together in September, we choose the 10 measures. And then in between that September and end of the year meeting, we as the design team will have to meet again to create a draft of a strategic plan to propose to implement and sustain the data dashboard, as well as figure out if there are things to add as time goes on. And so our plan for this design team is to meet one more time at the end of May. I'll send out a doodle poll to this group after this meeting, because today we're going to go through a list of the preliminary shared measures that have been suggested, and then we're going to send out to this group, as a way of getting feedback, just a quick survey monkey that should take you not very long to complete. But on each proposed shared measure, we're going to ask you if you think it meets the criteria that we've agreed upon, and then if you think it is a top 10 measure, as well as if you have any comments on you'll be able to add those if you wish. But certainly, if you don't, just a quick yes, no, meets criteria, and then yes, no, top 10, so that we can meet again in May, have a quick meeting, go over the proposed shared measures, and agree that we're ready to present them to the full group in June. We also are going to ask some of you, if you're interested between now and our end of May meeting, to help us just look at some known surveys that are out there, and we'll go through what those are and see if we missed any, to see if there are any shared measures that didn't make the list that we have today that really need to make the list for consideration, and including them in our June full group meeting. So you can look for a doodle poll after this, as well as a survey monkey, and that'll keep us moving forward in being ready for the big group meeting in June. Does anyone have any questions or comments or thoughts at this moment? Okay, fabulous. So we're ahead of schedule, hopefully. And the next thing we're going to do is talk about then the criteria, and Deb's going to kind of go through those with us. And these are based on the feedback we got in February, as well as some additional feedback. So I'm going to pull them up, and then I'm going to share the screen again.
You are so impressive.
All right.
Amazing. I'm just like, give it up for the technology. Those healthy babies. Okay, so these are the criteria. If you remember when we had our first kickoff, that was part of the conversation, was criteria. We then also brought it to the Best Beginnings Advisory Council, as well as, well, that was it, I think. And then we honed that down to sort of what we heard as major themes. And so I think what we'd like for you to do now is, you know, ask questions about this, hopefully verify that these are solid criteria. When we did the Survey Monkey prior to this call about different potential measures, there were a couple comments on the criteria that we've integrated into this presentation. So I think the goal is I'll review it and then like to make sure that people have questions answered and hopefully are comfortable moving forward with these criteria. So the first, as you can see, is impact on children. So really wanting actionable data points that we, you know, with our best understanding of what research says, with the capacities that we have in our communities and in our state, this will actually result in impacts on children. The second is accessibility, so easy to collect. We're already collecting it. There's an ability to monitor it, to look over time for time spans that we're actually moving it. Actionable, relevant to both urban and rural communities. You know, a lot of our work is based on the core value that so much of this work happens at that local level. And so Sarah mentioned that part of the process of the design team is to put this together, and then we'll kick it back to the community coalitions to really think it through, as well as ask you to do that through your networks, and that it's high quality, that they're valid sources, they can be used to establish baseline. So those are the main criteria that came out of the conversation. And then some feedback from the responses we got prior to this call are, one is really wanting to be thoughtful about cultural relevance when we talk about definitions around health and family, and I think that's still work we need to do. We haven't really drilled into definitions in this process yet, but I think that we need to recognize that, particularly if you're looking at work that's actionable, relevant, and relates to community work, it really needs to be something that's defined within that cultural relevance, and allowing for disaggregation by race, so that if communities or state partners want to be really honing in on work with the most vulnerable populations, that they're able to do that. So that's the criteria that we consolidated from our conversation when we kicked this off and when we got together with the BBAC. Comments, questions, concerns? It's an open forum.
But we'll hear you better if you take yourself off mute.
Interpretive dances are encouraged if you have a video.
I really like the comments, particularly the one about the cultural relevance for definitions. And what I've sort of ended up doing pragmatically is your family is whoever you say it is. I've been in meetings where we spent ungodly numbers of hours trying to define what a family is. So I think that it's really important to have language that acknowledges that family will mean something different for different people.
Thank you. That was Dr. Sege, if you don't see that. Thank you. Other comments, thoughts, questions?
This is Erica Johnston. Can you help me understand what the goal of allowing for disaggregation by race is again? What questions would we be trying to answer by having a data set that's able to be disaggregated by race?
Is there anyone out there who wants to respond to Erica? I mean, this wasn't one that came out of our list. Initially, it was feedback we got, and I'm happy to.
I'm not disagreeing with it. I'm having a hard time figuring out.
So this is Kristen in Billings. I wasn't the one who gave that input, but I like it. And part of the reason for me is that it helps, it goes to that criteria of actionable for me in terms of looking at needs. I mean, in our community, I'm in Billings, and in our community, trying to figure out what the most effective strategies will be when you're looking at even city level data is not enough. So for me, disaggregation by race helps me to understand, what approaches might be culturally appropriate, who might be the best players to help figure this out. And then I also think that's the most important reason to me. The other reason is that there are funding sources out there that require that kind of information. A lot of funding sources require that. And then some funding sources only fund to certain, it has to be an American Indian project or Hispanic, or, and I know Hispanic's not a race, but anyway, that's what I would say.
This is Tala. If I understand the question correctly, is it a question about what exactly disaggregated data is? I'm the one who put in that.
Can you say more?
I'm sorry?
Can you say more?
I think she understands what disaggregated data is. I think she wants to know what the purpose of making sure that the data can be disaggregated what purpose that serves in terms of this data that we're collecting. What would be the importance of that?
Okay, different races and ethnicities face different situations, even if we try to pretend that we're all colorblind. Different factors affect the well-being of different populations. So it's important to have those distinctions in order to address issues both culturally appropriate and specifically there was mention of the most vulnerable populations, those populations most in need, and they often tend to be non-white.
Hi, this is JP Magneto. In that same thought, I guess, do you guys just stop at race then? Do you go with age, gender? I'm almost thinking as if it's just a research data collection. You know, every time you do research, you have to disaggregate based on ethnicity, religion, gender, age, I mean, name it. So for the purposes of trying to get something data as far as who to reach out and for whom, do we just stop at race then, if that's the rationale?
Well, race is, along with age and gender, are one of the things that are collected, not consistently, but somewhat consistently. Religion is not. Using Montana as a situational example, access to health clinics, for example, depends very much on whether you are American Indian or white, whether you live in a rural community or an urban community. So in that situation, your age and your gender doesn't matter so much, but where you live and what race you are does matter.
Gotcha, thanks.
Sure.
I do think to the extent we can disaggregate by age and gender would be helpful.
Thank you. So let's have that as one of the things that we're holding in this conversation. Other comments, observations, questions about the criteria?
I think as we go through, accessible is going to be pretty interesting to sort out for each kind of measure, because there are different ways that the state already collects measures, and then each coalition might have capacity or already be collecting data. So I think that's going to be pretty complicated to sort out, but it is crucial.
Yeah, and I think we're also holding on to the wish list space. You'll see that when we talk about the measures that we are really trying to hew to the purpose and intent of the project, which might mean that we settle on one or two measures that we know that if we could figure that out, we would really be able to align our work with more impact. And so we're going to figure out how to get that information, right? So we're not totally discluding the idea of an important data point that's not particularly easy to collect, but I agree with you that that's going to play out in different ways. And I think that as we get into the once we kind of settle on what we want to be gathering, there's going to be, I think, a whole effort around the strategic plan that's going to be about, how would we act on this? How would we actually, regularly, reliably collect and then reflect the data on a regular basis? Other thoughts, questions, concerns? So what we'll be doing next in the process after this call today is circling back to the measures that we've identified and you've helped us identify and running them through these criteria. So I'm guessing that there'll be more questions that will come out of that process that we'll do our very best to help shepherd. Do you guys want to add anything to that at this time?
No. I mean, I think maybe people, are there other comments on these criteria or not? Otherwise, yeah, I think that's where we're at. Okay. All right, so next on our agenda is really, first I'll go through the SurveyMonkey responses as well as the other folks' responses in regards to the shared measures that are more of like the traditionally used shared measures, and then we're going to turn it over to Jeff and or Bob to talk about potential hope measures that they might propose that this group consider and would be included in a SurveyMonkey. So I'm just going to go through these and then we'll open it up for comments like, oh my gosh, you can't have that on there, or I just want to throw this out there because I have to say something now about it, and that sort of thing. But we're not going to do it on each one individually at this moment. But so here's our list. So baby-friendly hospitals, and I don't know if all of you are familiar with baby-friendly hospitals, so I'll give Bree 20 seconds to sort of, it's a national certification. Go.
Sure. It's a long process of making sure that moms and babies succeed at breastfeeding if they want to. And it really starts that, early attachment off.
And it involves policies and practices.
Many policies, yeah. Yep, it's about a 5-year process that many of our birthing hospitals are in the middle of.
All right, and then the next one, someone had suggested the number of births, and as well as considering the number of those births which are low birth weight babies, so obviously the low birth weight rate as well as the birth rate. The next one was well child visits, and this would have to be obviously a more well-defined criteria, like what constitutes well child visits. Are we going to go with just the recommended visits? How is that information available? But that was one that was suggested. Postpartum visit, do new moms have a postpartum visit? Immunization rates, kindergarten readiness / however, if there's an OPI measure that already does this, Deb shaking her head no, or whatever. I know that looking for preschool development block grant perhaps to help us with this one, because I know it's a part of their ongoing work under that grant. Communities with early childhood coalitions or referral networks, we just wanted to include a broader, if there's something that's not, that came from Illinois. People had suggested using child protection services data, child abuse and neglect, home removal information, numbers, rates. I know that's, something that's available through DPHHS if you're talking about numbers of children receiving services, that sort of thing. Suggestion had been made about child care slots versus children eligible for care. So that was some data that we had seen presented at the Best Beginnings Advisory Council through someone at the University of Montana who had been able to analyze, there's this many available slots, and it was by age. I don't know that it would be disaggregated by race, but, we can do some more looking into this data. But they were able to tell the number of children who had, I believe, working parents and versus the number of available slots. One suggestion was the number of STARS providers. So the quality rating improvement system for childcare in the state of Montana, if all of you aren't familiar with it, is STARS to quality. And so that number is accessible and available, and there are different STAR levels. So just monitoring the number of them and ideally increasing the number as a measure. Someone had suggested the average childcare worker wages as a measure. And I don't know, Caitlin is out there. I don't know if that's something that's available. But we certainly have expertise in that area on our design team. We have the number, someone suggested the number of children in preschool, and that would be, I know that there's probably some numbers from that same preschool development block grant. I don't know how comprehensive they are versus the number of preschool age children. We had the suggestion of using the number of families with children ages. There were different ages suggested, so I just put STARS there, but that could be defined. TANF numbers, numbers receiving SNAP benefits, number receiving WIC. We also had the suggestion of the number of children under 18 who have a medical home, number of children and families with access to or receiving home visiting services. This one was somewhat vague, but we added maternal, physical, and mental health rates. You know what? That's all it said. That's all it said. Okay. Access to prenatal care, the rate of children in poverty, and then this is a duplication, the vaccination rates. So that was the list that we received. That's and I would just say now I would ask for your initial comments, like get that off the list. It doesn't even need to be included, that sort of thing.
What's missing?
What's missing? Yeah.
This is Sarah. I have a quick question. Do we have any potential measure to gauge the health literacy of parents in the community?
Does anyone measure health literacy that you can think of? I mean, is that what you're asking?
Yeah, that's something we're looking to do in our program and looking for a good measure for trying to understand where parents' health literacy might be.
I'm
Which
sorry,
I think,
Sarah, can you say where you're from in the project?
yeah, absolutely. This is Sarah Savage, and I'm the Early Childhood Education Director with HRDC's Head Start programs in Bozeman.
Sweet, thank you.
Yep.
There was one, and I think it's my fault for not getting it on this list. Somebody did talk about trying to get at that same question, and I think the way they came at it was more about sort of what are the resources available for families in a community, and allow that to be kind of going back to what Dr. Suggi was saying about self-referential, allowing that to be defined by the community. You know, what is a parent family resource, and then trying to track that over time. Could I kick that question to Bob and Jeff in terms of the work you've been thinking about in terms of family resiliency and literacy and well-being, or do you want to wait to respond to that? Bob, you're muted now. Thank you.
Boy, if only I'd been unmuted, you wouldn't believe how wise what I did.
Whoa, man! Game over.
What I was going to say was, it might be best to put out our measures, the ones that Jeff and I talked about, and then kind of do a grand sifting, because you'll see a lot of themes that are new and different, and a lot of themes that have totally overlapped. So,
right, so if you
just for efficiency's sake, maybe we should do it that way. Is that okay?
Yes.
Yeah, do we want to do that right now?
No, let's get feedback on this, and then we'll flip to yours.
Perfect.
Yeah.
Thanks, Bob.
Okay, I'll just sit back and mute myself.
Oh, we can mute you.
This is Kristen in Billings. And one thing that I was thinking about this list is, I know we've said ideally we'd like 5 risk indicators and 5 hope indicators, or something of that nature. In order to kind of think through this list and the next one that we're going to get, I think it might be nice for us to think about sort of categories of indicators, like, what are the, besides risk and hope. I mean, in the risk category, for example, we could take this list and say how many of these are in the risk area, and which one would be the most important, most telling around family health, family thriving, in order to narrow them down. And I don't know, it just seems to me like we might be able to do some categorization that would help us. That's all I wanted to say.
I think that we'll have to think about that when we create that survey monkey where you can rate things, and we'll see if we can't come up with a creative way to add your suggestion into that.
Yeah, because I'm thinking, financial stability is clear in a lot of these indicators, for example, and we know that's important. So, maybe are we looking at one financial stability indicator, and then health indicators, are critical. So we're looking at 1 or 2 health risk indicators, and then are we looking at, physical health, behavioral health? Anyway, that's kind of the type of categories I was thinking about. And then there's some for parents and some for children. So thinking about those.
This is Tala with Kids Count. I agree with Kristen, especially the last comment that you made, some for children and some for parents, because the well-being of children is so dependent on the well-being of the parents. So not leaving them out of this equation, I think, is very important.
We agree.
Yeah, some of the buckets I've seen in this work based on research are around healthy pregnancies, and then thriving families, and then some sort of mark around readiness for school, which, you know, so there are these sort of broad themes that research continues to pull out. And so we can try to cluster things and kind of see how that works. And that gets at, I was thinking about this earlier, kind of gets at some version of a theory of change that I think would be helpful for us to map out, so that the indicators are clearly tied to some assumptions we have about what leads to better outcomes.
And I think that can help us at our May meeting if we format it sort of in categories with a sort of a theory of change guiding how we're going to prioritize.
Yep.
I can be heard without being seen.
Other comments? This is really helpful feedback. Other comments or questions, observations?
Hi, this is Caitlin. Can you hear me?
Yep.
Okay. And I'm here with Cassie. We're here at the Early Childhood Project. And just on that one indicator around child care worker wages, we were just looking at the Indiana profile, and the category around early childhood care and education workforce. And we feel confident that we could collect data in all these categories, which are around the workforce, just the number of people who are currently in the workforce through our registry data, the number of providers who have a bachelor's degree, the median salary for preschool teachers, and we could even break that down even like further if needed. And then the projected workforce deficit, if we were looking at the number of children who were eligible for care, we could break that down by ratio and kind of get an estimate for the number of providers. So we just wanted to mention that if we wanted to have more, you know, kind of like how this entire row is built out, we could provide that information too.
Great. And I just want to point out the how well Caitlin modeled the use of the binder that Sarah put together. Hopes that we see you when we see you again.
I have to give credit to Kat because she went and printed out like a really nice version.
Yeah, but that's such a nice tangent. That's such a great example of a super tangible, you know, we're talking about this. This is how it connects with what we've got right now. So thank you. Do we have anyone, I heard from, I think, Sarah, is there anyone else from a local community coalition on the call that can add their voice to this conversation? Do we know if we have anyone from any of the coalitions on?
They didn't volunteer to be the design team, other than Kristen.
Well, Kristen, yeah, Kristen.
I'm here. I'm with the coalition.
So can you put your...
And this is Carrie. I'm also with the local one.
Oh, perfect. Oh, that's right. Flathead. Thank you.
So I'm sorry, what her name is?
Carrie.
Carrie. So Carrie, can you give us a little feedback? Not to totally put you on the spot, but you did just offer that you're on the call. So how's this connect or not connect as you imagine some of this eventually rolling out in a local community coalition?
So am I unmuted?
Yes, you are.
Let me see.
Yeah.
Okay, fantastic. I think I love the idea of grouping. I think by lifespan piece, I think that would really help me see. And the other piece that's kind of going through my head is whether we could get good comparisons across counties, because I feel like that's I don't know, I think that was my concern, whether we would have really good county level data, especially if we're splitting into race and other categories.
So
but I like it.
Good. So is part of what you're saying that different counties have different capacities to gather information, and if we try to aggregate things to a statewide set of measures, there'll be some problem in translation and access? Is that kind of what you're naming right now, or is it something in addition or different from that?
No, I think that's perfect. I think at the county level, I feel like there's this push to know how we compare to other counties. And so I think anytime we could help have that conversation, it would be really helpful.
Terrific. Thank you. Any other comments that you might have? And then I'll ask Kristen Kristen wears so many hats, I'm going to stick her in her coalition hat on this question. But do you have anything else to say before I ask Kristen if she wants to add from that perspective?
Oh, no, I'm good. Thank you.
Awesome. Thank you. Thanks for being on here. And then Kristen, do you have other thoughts from just kind of thinking about your coalition, thinking about the partners, the work you've been doing, how this relates or doesn't relate with support or would be challenging?
No, I think it relates. I love the criteria, that you introduced at the beginning, especially the actionable piece. No, I think it all applies for us. And just having written a grant for our coalition, the Bighorn County Coalition and the Carbon County Coalition together, getting data, we're trying to put together a 3-county picture for our best beginnings was not easy. And so I'll just say ditto to the last comments.
That's awesome. Thank you. And then I had a couple questions maybe for if our Blue Cross Blue Shield folks are on, and or Erica from the Medicaid perspective. Could you maybe speak to maybe like the well child visit or postpartum visit, what proposed measures and any immediate feedback, or children with medical homes, that sort of category? And when I say speak to it, I mean like related to the criteria or thoughts you have about, that's not impossible, or that what would be possible maybe?
Yes, this is Erica. That's my question. Are you asking if that information or data is available and could be considered as part of this data set?
You're quiet. We can barely hear you.
Oh, sorry. I'm hooked through my computer. I don't know where my microphone is.
Not by your mouth. Just kidding. No, I can hear you a little better. Sorry,
So,
go ahead.
is the question whether or not it's available for consideration? Because if that's the question, yes, I believe that our data set in Medicaid is robust enough to pull out that type of information.
Right. And then yes, that, but also like what does it look like? Like, I don't know, like, would it just be like, I don't know, like, I can't think of the right medical word, like encounters, you know what I mean? Like we would just measure the number of children who have a medical home, or the number of children who make every recommended well child visit. I don't know if you have thoughts on that. That might be too specific.
That actually, the number of children that make every recommended well child would take that's a heavy lift in terms, we have to analyze the data. We can't just put in some criteria and pull out from a query. We'd have to do some data analysis. So yes, it's possible, but it would take some work.
Okay, it's not just there. Okay.
Right. Not just
can I interject? This is Tal again. I know a measure that we've been using, and it's part of existing state reporting, is the number or the percentage of children on Medicaid who take advantage of the early and periodic screening, diagnosis, and treatment program. Because it's not perfect, but it can be an approximation if we're looking at only the Medicaid population.
Okay.
That reminds me that I do think screening, developmental and disability screening would be a good indicator that's not on here. And that's available through Part C, I would imagine.
For children who are referred, right, to Part C, not for all children.
Would Blue Cross Blue Shield chime in for a minute on those?
Can we put you on the spot?
Yeah, I mean, I can tell you that sorry, it's JP Maganito. I can tell you we have a data analytics team. Now, as far as trying to get a specific data set, usually more times than not, it's really code-based, right? CPT codes, HCPCS codes, and the like. Can we get it out? Yeah, absolutely. I mean, I think we can find a way. We can certainly, as long as we have a defined data set that we want, then we can certainly give that to the analytics team and see what they can pull out. But I have to admit, it will be fairly difficult unless we have some sort of code that we can easily pull out.
Is EPSDT a code that you use as well?
Yes. Yep.
Yep. I just want to interject. Do you guys use HEDIS measures? Because another way to do this is there's already quality metrics that most insurers pull out. So
yes.
One-time immunizations is one. There are a group of them, so we may be able to just glom onto data that you're already collecting.
Yep, and so we do have a HEDIS team actually working now, and there's also the value-based care and patient-centered medical home folks that they have their data. Again, as long as we have a definition of what you guys want, I'm sure we can tease out those data.
Mm-hmm.
This is Kristen, Coalition Boots on the Ground. Just practical question back on the screening stuff. It'd be good to know how it works in communities, who's doing screening. I know in our community, Billings Clinic and St. V's refer a lot to Part C for those screens, so they don't do them, or at least before the budget cuts, they weren't doing those screenings at the clinic. They were referring. Of course, they do some kind of screening and well-child checks, but they have pretty standardized referral process out to Part C. So anyway, it'd be good to know how that works in other communities. And I'm not sure right now, again, with the budget cuts and changes in my community, exactly how that's working. But it would be good to know.
This will be super important. I'm glad that we'll have this process of valuing, because it sounds like, you know, some of these big things like well-child checks or screenings, if we can all agree that people want to do a heavy lift on, you know, just the most important one or two, that I'm so glad we're able to get everybody's feedback, because it doesn't sound super easy. We did speak, Dr. Maganito, we did speak with Patty Estes the other day and Monica Berner too, and they were thinking that the medical home, children with medical homes might be kind of an impactful measure. Do you want to speak on that?
I'm just kind of getting started with the whole medical home, but yes, definitely Patty Estes is the person to go. Okay. They have a huge amount of data actually showing improved care from the provider side as well as the member side. So we have that, yes, definitely.
And then I had another question. Is there a code for doing a developmental screen within like a well-child check? Some pediatricians are using the ASQ or the ASQSE in clinic. Is there a
yes, there is.
For that?
There is, and I can't think of it off the top of my head here.
Okay.
There was a recent discussion on it a couple of weeks ago, actually.
Okay, good.
Yeah.
So that could get to Kristen's question.
Other thoughts? Otherwise, I mean, I will turn it over. A lot of this overlaps with what Bob and Jeff are going to talk about. Do you have their grid to pull up? But as we work on pulling up their grid, I would leave it open for others' thoughts.
And I think that this conversation can continue. I think this is Jeff Linkenbach talking to you from Bozeman. Hello, everyone. I do have my binder next to me. I'm not showing it on the screen right now, but just to let you know that, Deb. Couple things. One, what we want to talk about, Bob has been taking lead and really looking at what would be some of the HOPE measures, meaning the health outcomes from positive experiences that we might look at that are validated and other research tools and places so that we could have some anchor questions similar to some of the things that were coming up here. I do want to say, and if we could hold it till the end, I'd appreciate this, but I want to kind of put a little placeholder before we forget it, that one of the areas that we know we want to explore more, and Tala or others, you may have comment on this after we go through this, is something related to connection to culture, culture as strength, culture as not just resilience, but as a real, positive, thriving factor. So wondering what we might include there. But with that, I want to turn it over to you, Bob, and just have you walk through some of what you've pulled together and some of the measures and the sources from which they came. So drum roll, Dr. Bob Segi, Tufts University.
Thanks. This is going to be, hopefully will resonate with what we just talked about. So first, we sort of set up some of the hope domains, and those are the left column. And so there was some discussion that parents matter, and you'll see that the first two about parents and then family, and then we ultimately get down to the child. Children are important. And then we tried to put a little of the concept of what the measures were. For the most part, these are already measures that we think exist. And I wrote down where they come from, and sort of what ecological level, whether they're family, individual, or community, and just a few things about them. So the first two are measures of mental health and social connection. And these are both from the National Institutes of Health. They have a set of very short questionnaire modules that they're promoting for use in research studies. And they're all available as either like a regular survey, a 10-item survey, or something that's called a computer adapted form, which means if you answer one question and it sort of indicates the answers to the rest, or they don't matter, it just skips over the other questions. The advantage of them is that they are well validated, well understood, and they're normed. So there's some idea of how each individual who responds to them compares to the United States population norm. So it's pretty off the shelf, well validated, but that obviously requires a survey of some sort. Similarly, the most widely used measure of general health is called SF36, which I thought stood for San Francisco, but apparently stands for short form. And there's something called the SF1, and the SF1 is the first question from the SF36. And instead of being 36 questions, it's one question. And the question is, I may be getting the word slightly wrong, but it's how would you describe your own health? Excellent, good, fair, poor. And what's amazing is that one question has a lot of statistical validity in terms of predicting the entire result. And again, this is an extraordinarily widely used measure. So if we ask parents about their general health, it gives us something. And obviously, healthcare access, people talked about. There are two easy to get at measures. One is the mothers with a postpartum visit within 2 months of the childbirth. This is relatively easy to collect because it's part of the overall childbirth package that Medicaid pays for, so that poor women are covered by Medicaid through childbirth and the first 60 days after birth, even if they, without their children, don't qualify. So it's a complicated thing. And similarly, I'm interested in how Blue Cross Blue Shield collects that. And then there's a BRFIS measure, the Behavioral Risk Factor Surveillance Survey, which the state does, Montana does every year, all 50 states do. And the item is the proportion of women aged 21 to 65 with a PAP test within the past 3 years. And the advantage of that is it's already collected, because I believe Montana does do the BRFIS. And again, I certainly care about cervical cancer, but you have to go get health care to get that test. So generally, that's considered a reasonable marker for women in particular getting actually accessing health care. So those four are really ways of looking at parent health. I'm going to roll through, and then we'll get comments later, if that's okay. And for family engagement, one of the things that we talked about at our summit meeting was to look at some of the qualities of the programs that are offered by the coalitions. And so one thing that obviously comes to mind, and this rises out of our conversation again today about what is a family, but how many Montana residents are served by coalitions that have programs that have identified outreach components for fathers and grandparents. This is obviously a community level measure, and this might link to technical assistance if we all think that reaching out to the broader family, not just the mother, would be helpful, then there may be ways to do that. And I think that's actionable and might be interesting. And then family engagement, there's a question from the National Survey of Children's Health, which is how well can you and your child share ideas or talk about things that really matter? One random question, but I believe in the National Survey of Children's Health, it's one of a series of questions about family engagement within the family that I pulled out. And for child health, as I mentioned earlier, I think that there are HEDIS measures, which stands for something really important. Health something system is what HEDIS means. And it's a way that healthcare systems are measured. The measure that works really well with young kids is on-time immunizations by age 2. Other people have mentioned EPSDT, so delivery of EPSDT services are other HEDIS measures, and a lot of healthcare insurance companies and Medicaid use these to monitor the quality of care that patients are receiving. So again, the beauty of this is in order to be on time for immunizations, you have to be plugged into healthcare. So it's a measure of what proportion of Montana residents are getting regular healthcare for their kids. I left there are measures of the actual child's health that are used in the National Survey of Children's Health that have to do with disability, illness, health, flourishing. So there's a whole bunch of things, and we wanted to go down that path. Again, the National Survey of Children's Health, the most recent one, was administered in collaboration between Johns Hopkins and the Census Bureau, so very well validated questions in multiple languages that are easily available. We've talked about child education, so I'm not going to spend too much time on this, because they've already come up. The portion of children in high quality early childhood education, and whether children show up at kindergarten ready to learn. And most school districts will have some sort of assessment at kindergarten. I don't know how standardized that is across Montana and how available that data is, but obviously that's a super important goal. And then Jeff can talk about this a little bit more, but at the summit meeting, there was a man whose name is Gary, who has all this beautiful data about the state of Montana that's geo-coded. So it'd be really interesting to find out, for example, what proportion of Montana children by community have access to safe outdoor play space. So there are a lot of ways of looking at what that means, but we know that children need to play. And I struggled with finding a way to look at that. So I thought access to good, safe places to play might be worth it. Cultural and community connection. The question that we added to the Wisconsin Behavioral Risk Factors Survey and published in the HOPE report was how often do you enjoy participating in your community's traditions? Never, rarely, sometimes, often, or very often. And this might be one way of getting at the cultural question specifically. And then there's a question from the National Survey of Children's Health that looks at the community support part, is are there other adults you can turn to? And then finally, there's social norms. And I think that one of the underlying propositions here is that Montana supports our young children and their families. The concept is, boy, I shouldn't quote the person who lost the last presidential election, but the concept is that it takes a village to raise a child. And the general framing of these measures is other adults in Montana believe or do or say or think this sort of thing, so you can get an idea of what statewide social norms are. And Jeff has done a lot of work with this. He's done the Montana Parent Survey. YouGov.org did a survey, PCA did a survey, all of which is really in Jeff's and his group's capable hands. And that's probably best studied at the state or county level, because what you're really asking people is what their neighbors think. So this is one of the ways we're thinking about it. Obviously, there are more than 5 measures here. And some of them require a statewide survey. Some of them require just using data that's collected anyway. And some of them are just require a decision to use it, and some of them require some item development. But I think that this may be helpful to people to sort of understand how we're thinking about it in terms of domains, concepts, measures, and as much as possible looking for measures that someone else has already invested in developing, validating, and we have something to start with. So hopefully that's helpful, and I'm curious about you all's responses to this.
Right, I think we just open it up again for folks to comment or ask questions based on this graph or chart, table.
Kristen, I'm just going to weigh in that I love the geocoding idea. We've done a lot with GIS for our own needs assessment, and it's just super helpful because there are so many data sets already in GIS, including all the demographics in the census. So, and we actually have a map similar to the one that you described around play areas and things like that we had done in our community. So I just want to say I like that. I like a lot of other concepts on here, especially those first 2 on the maternal health and the social connection. I know we probably don't have those existing, but I love the idea of being able to measure something like that over time, or that 3rd question, that 1 item question. And I was thinking, I know we don't have it, but every community does a community health needs assessment. It seems to me like something like that, if it's not already on there, could be put on a community health needs assessment.
Others?
Yeah, this is Tala again. I have some questions, and then I have some buckets of cold water. I'm wondering about the NIH Promise survey. Is that something that the feds give grants for?
Not exactly.
Or what's the framework for the surveying?
The surveying, what they like is if you're going to ask questions about these domains in a grant that you applied to NIH for, they would love for you to use these measures because they're validated. You don't have to spend too much time in your grant saying why this is a good measure. So they're trying to push people to using common measures to for each of the domains that are included in the NIH Promise data. That's it. They're available free in any format.
And so it's something that's embedded in a larger project or grant?
No, say you're writing a grant to NIH and you want to, as one of your outcomes, you want to look at general life satisfaction. You could develop your own survey, or you could use somebody else's survey, which is fine, and you have to justify it. But if you just use the NIH General Life Satisfaction Survey, then they give you a pass on your grant application.
Right. I was more thinking about how that happens in each state. It doesn't happen unless somebody is doing a grant that looks at that.
Yeah, imagine this was a binder full of measures. Okay, and you look in the index and you say, I want to measure for that, and then you pull it out and use it. So it's not administered routinely by anybody anywhere. There's a set of measures. If that's a concept you're interested in, here's a way to measure it.
Okay. So it's doable. I really like you bringing up the PAP test measure from the BRFIS, specifically because it's part of the full population and not just the Medicaid, which is, I think, if we're going to pick some kind of flagship indicators, they should apply to the entire population, not just a subset. I did check, and that module is included in the Montana survey. We do the BRFIS every even number of years, and it seems like that one's going back to the beginning. I also looked at the community connection measure, and Montana does not include that as a BRFIS module. I don't think they ever have. I haven't found anything, just like the ACEs. They only did the ACEs once, or we did. So that's something that I know if the persuasive campaigns may work for getting that included. So that is definitely a possibility that I see.
That'd be nice, because it'd be great to have some other states, Montana being one of those, that starts to look at that as one of the potential hope measures. So.
Yeah, and it's great that it's like the NIH promise questions. They're existing modules that don't need to be tested, and they don't need any kind of OMB approval.
Does anybody know anything about the Gallup? Does anybody know anything about the Gallup well-being polls, and if they measure any of these kind of indicators for Montana?
I do not.
We can try to find out. That's a good question. And I think Bob asked about your buckets of cold water when Kristen was speaking.
The buckets of cold water, one is that the BRFIS is not in Montana doable at the county level.
Oh.
Because we have a small sample. The same with the National Survey of Children's Health, does not do county level data. Those were
buckets of cold water.
Yeah. Also the irregularity, I guess, with the National Survey of Children's Health, there's not an established regular schedule for that.
Yeah.
I was going to ask about it. I was going to ask about that. How often or when has that been done in Montana?
It's done nationally. So when it's done, Montana is part of it, but they do it when they have money.
Okay.
Right.
Let's just put it that way.
Yeah. So I guess one of the questions this raises is there appetite or budget for creating a Montana state survey that would include items from these things like the BRFIS module and such that people would be worth investing in, or is it something that community coalitions could use on a spot basis? I'm not a survey researcher, so I don't know how complicated that would be. But so another way to do it, instead of giving all of NSUCH and all of BRFIS, would be just to have a certain number of questions that that would be asked of Montana residents. And I don't know what the budget or appetite for that would be.
Well, I have a survey research lab in the office next to me.
Good.
And I know it's not complicated, it's expensive. And especially committing to having it done repeatedly at regular intervals, funding would be an issue.
Yeah.
But especially with these measures where you've brought up tested and true measures, it's a lot easier because we wouldn't have to come up with new questions and test them and mess around with that.
Yeah, I know that that's enormously expensive because it requires lots of skill and lots of people and lots of time to develop measures.
Well,
Yeah,
and this is why I brought up the community health needs assessments. And again, I don't know, but I mean, there are community health needs assessments done regularly. They're required to be done regularly across the state. They are looking at local data. I mean, I just wonder to me, it seems more feasible that we would get the folks implementing community health needs assessments across the state to add a question such as the SF1 on their community health needs assessments that would then be collected regularly across Montana. I know they're not all on the same schedule, at this point, but I don't know, that was what occurred to me about what might be realistic and sustainable in terms of some, those items.
I'll just jump in. This is Stephanie, and I'm an MSW student, and I worked with HMHB, and I did a statewide survey of the community health assessments. And what I've found is that there's really very little direction that folks who are producing CHAWs or CHIPs get. And so there's also really a lot of variation in terms of what kind of products each county puts out and how much they have in terms of resources. So while there is, this uniform process, the products that come out of each of those are so different. Just consider maybe a very small frontier type of county versus Gallatin or Missoula counties. You get really different things, but I really like your idea of identifying that opportunity to give some direction and start to work with that. Yeah.
Are there any, Steph, are there any like required questions that would be the same already, or would that be a whole new concept to this process?
I don't know that there are. I haven't talked to anybody that has told me that they had a required concept. It's, some of them, they're pretty distinct. Some of them, ones will be much more medical in nature, and then others can be much more, I guess, maybe community based. So I don't know that there are a lot of hard and fast rules that folks have to meet. I think they just have to do them and submit them. So they can be pretty different. I can say that people that I have talked to on the phone are very eager to get some direction. I don't know, I would say maybe I talked to about 20 different representatives from different counties, and everyone, and specifically what my project was looking at is how can HMHB offer some assistance in terms of what we should report on in maternal and child health. And everyone was open to that idea of having some kind of direction of what kind of measure would you like to use here. Yeah, just any assistance in that, since it's such a every 3 years type of a project. Nobody in-house is generally an expert. If they're able to hire out a consultant, that's also really different. What is that consultant looking for? What is that organization able to, that organization or individual able to help them with? So it comes down a lot to resources, it seems. But yeah, I got the feeling of eager to get some assistance.
And I think that they're coordinating more at the state level now. Is there somebody from the Montana Healthcare Foundation on this call today?
I don't think so.
Okay. Anyway, I think that they have begun more statewide coordination with the help of the Montana Healthcare Foundation.
That's true, Kristen. Healthcare Foundation really did a big funding push to get more folks or more counties up to snuff with doing the process. And then also I know Carrie Pride at TPHHS is definitely involved in helping counties get the data that they request or get the process going.
Because I'm thinking that there might actually be a centralized place we could even bring this question and conversation to. And yeah, and just what you've been saying, I mean, maybe there would be some room for one county that has more capacity to do this kind of assessment to help another county. Economies of scale, might be a lot cheaper. I know our, Billings Clinic, St. Bees, and Riverstone certainly hire a consultant,
Yeah, and then when you get out to other communities and the clinics maybe within the town are performing that. There's also, I think one of the more innovative or distinct ones is the Montana Central Health District, which it's either 5 or 6 counties right in the middle of the state. and they kind of clump together. And I think they do this for other health functions, but they collaborated in order to do their community health needs assessment.
Yeah.
Yeah, so there's,
and that's what our
some
community
cool
does
stuff.
too, even though the hospital and public health are on different schedules. They
Mhm.
all, it's very unusual. It's like they're awarded nationwide because of the collaboration that they do. But anyway, I think that what I was just thinking is that I think there may be some structure set in place where we could more easily communicate than we could have in the past, and they might be more easily able to implement something.
Absolutely, I agree with that.
And so I think a lot of this discussion makes me really think and sort of just circle back to the fact that this grant also includes a strategic plan. So it's not just done with what can we access, what do we have, what can meet our current criteria, but what do we see in the future? And this would be a perfect example and opportunity, I think, where there is openness to going that direction if there's if that's where the group ends up with putting something like that in a strategic plan, so that we would have that data from the CHAWS on a county level basis in 3 years or in 5 years or in the next round of CHAWS, those sorts of things.
And which of these measures do you think are sort of already collected and just need to be assembled? So I think that we have Blue Cross Blue Shield on the phone, and I bet they also collect some of the stuff that I put under Medicaid. So there may be broader ways to look at it. But do you guys know? Someone mentioned geocoded stuff was available. What about the kids in early childhood education and kindergarten assessments? Is any of that readily available?
Bob, this is Bree. I think that the gentleman from Blue Cross had to get off at 10, so we could follow up with them with the email question. And then regarding the kindergarten readiness data, we're a local control state, and even down to our elementary schools, every administrator has the choice of whether or not they're going to do a kindergarten readiness assessment. So there are many local community coalitions that are looking at this, but it's such a, it's going to be very different. And so I think it's something that we're going to have to be flexible with, and we could also make suggestions about certain things to ask, but it's not like the state of Washington where we can just all do the same assessment.
But even if the question is in your district, how many of the kids come to kindergarten ready to learn, or whatever test you use might be just one way.
Yeah. Caitlin, what were you going to say?
You could use data from the preschool programs, like just look at state and federally funded preschool programs. So look at the state pilot that's happening right now, the STARS preschool, and then the Montana Preschool Development Grant. They're using DIAL, so you could at least collect data, and also through Head Start, you could collect those data points for kids that are leaving preschool, even if you can't get the kindergarten data once they go into kindergarten. I don't think we can quite make that link yet unless it's happening at the local level, but you could at least pull that data from those programs, because they're using the DIAL as a assessment for school readiness. And then Head Start programs use different tools. Some use DIAL and some use not the ASQ, the TS Teaching Strategies Gold. So there are a few different ways that you could collect that information, but I would maybe just specify if it's state or federally funded preschool programs. So the school readiness, and then we could also, just using the early childhood project data, knowing that the workforce is a huge contributor to high quality education, that we could use some of the workforce data, and that's readily available, as well as if we're defining high quality early childhood education through STARS, that's where you could also put in that data that would be collected through that program.
And then I guess I would throw it out there, I don't know, but I know we have pretty good, and I think in terms of like meaningful indicators, I'm no expert, but I feel like I've heard many times, like if you're reading by a certain grade, it is a good overall indicator as well, maybe as good as kindergarten readiness, that might be more accessible and easily available. I mean, that thought popped into my head too.
Yeah, they do smarter balance tests on a, you know, and the
third grade literacy levels or something.
That is available.
Yeah, third grade. It wouldn't be available in kindergarten, but in third grade we can have that.
Yeah, so I care about how old people, like third graders, how they read.
Well, it is
if
a
that's
good.
available, that wins. No, I think that if
It's a good measure of that we could see potentially move over time because of our work, hopefully.
Yeah, unless it's already perfect.
I like that. I mean, I like the preschool development data, but that's just so not reflective of our state because there's just so few of the preschool. You know, it just covers so little of our state population that I don't think it's a good indicator for the state. You know, for state, and then back to the criteria of being available, you know, at the county level, and all of that. I don't think it's really a very good measure of the county or state as a whole.
Yeah, that's true. It is really limited right now. We could. What do you think if you use like the Head Start data?
Even Head Start is so limited. There's not Head Start everywhere in the state. And they only serve, like in Billings, they just serve, I mean, they serve a lot of kids. I love them, don't get me wrong. But like a percentage of the population, it's not very big.
Right. So I think this is a good discussion. I don't want to cut it off, but I do have a question about that sort of then if we don't have really great preschool, but we have some good child care information, we have some workforce information, some stars. What about home visiting? Like what would be, like, is that something that came up on the list? And I know we've seen it on other states. Is that something local coalitions use? Is that something you think statewide? What would be, like, I mean, just the number of children who get home visits, or are there thoughts or other ways that people have seen that done well?
I'm one of the people who said I would like to see some kind of resource data count, like how many parent support resources are available in our communities, and I know that would need to be defined. So I guess I would say I like the home visiting. I'd like to expand it. Like that's not the only parent support service. So in our community, for our local coalition, we count the number of slots that are available for home visiting. We try to look at that in comparison to the eligible population served, the eligible population for the services, so we can do a gap analysis there. But we also look at parent education classes, like the Nurturing Parent, Love and Logic, those things, respite care. We've kind of defined some resources that we try to look at in terms of what's available for parents and what's the gap that we want to fill. So that's how we use that information.
I think that's a good point. What do others think about how that might be captured? Or
one thing specifically about the family resources is not just how many children they reach, but of what they define as their population, what proportion do they reach? Because I think that's also really really important and really a challenge for many programs. It goes back to some of the cultural issues.
Mm-hmm. So Jeff, you had a comment. Do you want to speak on that in terms of organizing by domains? I think that's a good point.
Yeah, just it's a question that as we move forward and are thinking about all of these different questions, and I know as a collective impact, it'd be great for us to be able to include them all. We know that we're going to limit ourselves to ideally the 5 and 5, the 5 risks, the 5. But thinking about domains and maybe, and I turn back to you, Sarah, Bree, Deb, but maybe this connects with some of the core values as well. How important would it be that we look across some different domains, maybe choosing questions in the, the individual child domain, the parent caregiver domain, bouncing out, broadening to community level, state level, or, societal level. Just wondering how important that might be, thinking that at the CDC, they would most likely try to look across these domains. I wonder if it benefits us to think of domains as one of our criteria for making our decisions.
Does Kids Count want to comment? I know we got a comment that you use domain.
I think I gave you a copy of the domain sheets that Kids Count uses, right?
Yes.
We're using economic well-being, health, education, and family and community. And it is a way to address, making sure you address all aspects of child well-being, child health, and not ignoring some sides. I mean, those are not necessarily what should be chosen here, but addressing different aspects of the childhood experience, I think I agree with Jeff, is very, very, very important, and it makes the job of selecting appropriate indicators easier.
Mm-hmm. So I think this. Go ahead.
It also helps in the storytelling, because looking at domains and having certain sort of indicators under those domains helps you say, where are we particularly doing well and less well? And like for the Kids Count, which is a broader, it looks at a bigger picture, not just the early childhood, but we were able to tell a story that in health, we as a state are struggling in particular based on set indicators. So it can generate a conversation in a way that is different than if it's just sort of all these different data pieces.
Yeah, it's a communication tool as well as a assessment tool.
I was wondering what you guys thought about, okay, so when we look at the indicator or the potential measure that was on the list before about community coalitions or resource networks, because home visiting is such a, a limited number of people served, would that fall in kind of under that category? Because we would think that, if the different family serving organizations are convening and are talking about access and what the community needs, that might be a strategy? Or do you think that should be something that we measure and work to grow, independent of that kind of early childhood resource referral network piece?
Are home visiting services available in all counties?
No.
No.
Right?
Yeah.
And even when they are available, they always sort of have a subset, whether it's teen moms or other pre-identified groups of high-risk families, and then of course the number of slots depends on funding.
Of course.
Which is often a complicated mixture of state, federal, and local money.
Mm-hmm. And some counties have systems in place by which the hospital refers all babies to public health, and some communities do not. So that's important, I think, to know about it. Whether or not the referrals can be followed up by a home visit or a phone call is the next question.
So it sounds like it might not be universal enough to really kind of like the preschool data. So I think Kristen's larger question is pretty good, like measuring parent resources, those sorts of things. And I guess Bree's question in my mind is, does a community coalition capture that, or would that be bigger than that? People's thoughts on that? Okay. Well, I mean, I think this is getting really good feedback. And I think this gives us sort of a good place I wrote down a list of questions that you guys have posed that we can go get answers from different programs and get information back before our meeting and get our survey out. The last thing that I know we did want to talk about as well was folks who might be willing or interested in reviewing existing surveys and making sure we haven't missed anything. We've sort of talked a little bit already about a wish list, so I won't go into that. But surveys to review, and they've come up. The BRFIS, I think that's the letters are backwards. The BRFIS, then the youth behavior risk survey that I know is done through the schools. Bree had a list of CHIP life course indicators that are out there that we might just want to review. And the purpose of this would just be to say, is there anything that's super meaningful in terms of like, it's a good indicator, it's actionable, it meets of all of our criteria that we left off our initial list. Are there, and you can email me after this, I'm not asking for a list of who's interested in doing that at this moment. I'm asking, are there other surveys that this little group or individuals should be thinking of before we call it good? Kids count would be another data source. I mean, I should have added, but we have you right on the phone, so I figured you might have added them already.
Just keep in mind that Kids Count doesn't collect its own data, no primary data.
Okay.
We are just a repository for what other institutions collect.
So along those lines, are there other surveys or data sources that you think need to be added to this list for a review?
I think I exhausted my capacity when I answered the Survey Monkey question.
Fabulous. Okay.
I just need someone to take a look at the Gallup. I don't know if it has any implications for our state or if they're screening here, but just take a look at that.
All right. So as always, if you get off this call and you think of something and you're like, oh my gosh, I need to, I should have said this, please just feel free to email me and or Bree and Deb, and we'll just be putting all this together and getting you the opportunity to give us further feedback on these individual criteria in a survey, as well as a doodle poll for our next meeting, which I anticipate will be probably shorter than this, only an hour at the end of May, just to prepare to roll these potential shared measures out in June to the full group. Does anyone have any other final thoughts or comments or questions or jokes?
I have sort of one question that would help me at least think about this, and that is, so the strategic plan is like one end of it might be to suggest the new survey, or is it all looking at data that's already collected by different state agencies and deciding that they're measures? So what is the first? Okay, great.
Mm-hmm. Because I think we've already had people express to us in individual meetings in different places that they would love to add a question, or they would love to consider adding something in the future if this group were to come together and say, this is really important, this is really meaningful, this would be really helpful. So I think that's on the table for sure.
Another thing I thought of as we were having these conversations, are any of these useful not on a statewide kind of measure basis, but within a coalition to say, how is my community doing on emotional support or general health or one of those things? So maybe another output might be a little bit of a toolkit that coalitions might use if they have a question or concern about their community.
Mm-hmm.
I like that idea from my coalition standpoint, the toolkit idea.
Mm-hmm.
Yeah, good.
Okay. Anybody else out there have any last things they want to contribute before we sign off?
Okay, well, we did record this meeting, so we'll put it we can, if you're having individual problems with accessing the site or accessing documents I put out there, still let me know. I've had some limited success, but I'm not any technical expert, and so it's probably better that we just work on those with our helper over here at HMHP with one-on-one. But we'll make sure the recording is available out on Zoom, and we'll put up the documents we shared today, and I'll email them to you too, since they're not giants or anything. And then we'll get you the Survey Monkeys and a doodle poll for our next meeting. And if you have anything urgent before then, just shoot us an email. But thank you all for joining us today. Thanks for filling out the survey. Thanks for making this helpful and moving this forward. We're really grateful.
Yeah, we are. Yeah.
I'm just showing you that picture is Montana in my office a little.
Oh, nice.
In Boston?
In Boston. Right.
Mm-hmm.
I'm with you in spirit.
Yep.
Oh,
cool.
Okay.
Nice.
All
Good
right.
work.
Thanks,
Great
everyone.
meeting.
Have a great day.
Thanks, everybody.
Okay. You guys too. Bye-bye.